Representative Ching.
Thank you, Mr. Speaker. I rise in strong support.
Okay, please proceed in support.
Thank you, Mr. Speaker. I also rise in strong gratitude, and gratitude to the Chair of Health, and the members of the committee, and the members of this House. I think that we'll understand how important this measure is, and that we take action immediately, because our people cannot wait. The recent closure of 2 hospitals here in our state beg the question of why on many different levels. One of those levels is that, Mr. Speaker, our people, our local people, they're not in the best of health, a lot of them. And one of the things that's afflicting the people of Hawaii is diabetes. Not all diabetes, but much of diabetes is preventable. And the fact is that our local people are most at risk because they have a much higher prevalence of it than do Caucasians. Japanese, Filipino, Chinese, all Native Hawaiian, we know, are very susceptible to this disease that is largely preventable. And currently, diabetes is costing the state of Hawaii per year over $1 billion. So this is not just the heart and tragedy of when we see, you can just go down to Kahala Mall or any of your malls, our people as amputees, our people unhealthy. On another level is a source of a lot of draining on our budget, our economy. 1 in 2 children born after 2000 will be affected by diabetes, so says the American Diabetes. And Hawaii has a much higher prevalence of end-stage renal disease, as our Chair of Human Services has pointed out in the past, than the national average. Right now, the way our state has been somewhat approaching it is we do have some things going on, but we have it often under the umbrella of chronic disease in general. And what this bill, and it was originally a diabetes SAR bill, but it's good still. It's a task force that will start to shed light and focus on this thing that's killing our people. It has not really been in the public eye. I submit, Mr. Speaker, it's not even a PSA to educate our people that, number one, it's a silent disease, like a snake. So by the time you get your first symptom, you've had it in your system for almost, maybe 10 years. Number 2, it's preventable. And a lot of it has to do with things we do on a regular basis. And number 3, our people are dying at an astronomical rate. It's an epidemic. It needs our attention. What I wanted to mention, besides the fact that dialysis, if you ever have a chance to visit, I urge all my colleagues to visit a dialysis center. $70,000 a year, 3 times a week, yeah? But the most important thing is, to me, our people, maybe we need to start looking at what we can do on an everyday basis. I know that we have been studying this disease. I'm sure that there's tons of data. And I applaud the efforts of the ADA. I applaud the efforts of all these organizations, the DOH. The question becomes, the provocative question, the question I would like to ask is, if every educated person, I can take anyone down Bishop Street or I can take anyone anywhere, if all people know that to help their health, they should eat right and exercise, my question then is, why aren't they? This is the provocative question. If we all know already.
Mr. Speaker, I'll use my time.
Oh.
Okay, thank you.
Thank you, Mr. Speaker. Thank you very much. My question is that, what can we do on a regular basis to improve the health of our people. What is it that we're doing that might be different from those that don't get diabetes? What is it that we have to change on a regular basis to help our people? Because I think those are the questions that I would like to see addressed in this task force. I come from the district, Mr. Speaker. I'm very proud of Plate Lunch, of Simon, of Spam Musubi, and I have to admit, I love my Spam Musubi. I love my Spam Musubi. I've been to the Spam Museum. I love my Plate Lunch. I am not advocating that we say, oh, no more. But what I am saying is balance. You know, Chinese medicine is based on a concept of yin-yang, balance. So for those of you who think this is not, you know, congruent with chocolate, no, it's about balance. Because our elders had balance. Our elders ate Spam Musubi, just not every day. They invented it, but they don't eat it every day. And they plant the mango tree in the backyard, and they take care of the plants, and most important, they're gentle with the people. So maybe these are things that we have to learn from our elders. When we're gentle, we take care, lower incidence, because the World War II generation has much less of it than their children. Thank you, Mr. Speaker.